Hello again, this is Dr. Kevin Connors. This is your second section for the help book, Help My Body's Killing Me. So even if you don't know that you have autoimmune disease, or it might be, I don't even know what that is really, this is really going to be a good course for you. So hold on and stick with me through these 12 little sections that you're going to have. Trying to keep these videos short, so I'm going to talk really fast. If you have to listen to it twice, go ahead and do so. Also, check out our website. You see that down there, connorsclinic.com. You'll find a bunch more information. You can actually download our Lyme book and our cancer book as well. But this book is on chronic conditions, those that have been everywhere and can't get better. That's what this is all about. Now, the biggest thing that you have to do if you want to get better is you have to learn to ask different questions, better questions, questions of your doctor, and find somebody who will be able to answer those questions. So if your doctor doesn't know the answer to those questions, it's time to ask another person. So there are answers to questions. There are answers to questions. I don't know all the answers, so I'm not saying that it's me, but you need to find somebody who can answer those questions. I can't be everything to everybody, but somebody can be what you need them to be to you. So that's what's really important. When we're dealing with chronic conditions, we're dealing with your body not working correctly. So we need to find out why. We need to keep asking that question. Why? Why? That's kind of our tagline. And when we're dealing with autoimmune issues, if we do come to the knowledge that it is an autoimmune disease, it's really important to understand that autoimmune disease is not a disease per se. So let's get it out of our head that we want to find a name for our symptoms. So coming up with a name for our disease is like we're just slapping a Latin label on a collection of symptoms. It doesn't solve anything. And for those that have a named disease for any period of time, understand that already, because the standard medical approach is to slap this Latin name on this collection of symptoms, and now seemingly it gives us a sense of peace because now we know, now I know I have MS. That's why I have all these symptoms. But doctor, what is MS? Well, MS is when we see white plaquing on the myelin sheath on a CT scan, and that's what we see on yours. So that's what enables us to give you that diagnosis. Oh, well, here's a drug. It doesn't help anything. So knowing that we have a name for our disorder is in no way solving the problem. We have to find out why it's there. Why are those plaques on the myelin sheath and causing disruption in neurological activity, so that now I have some peripheral neurological disorder? Why is it there? And never, ever, ever settle for it's an idiopathic disease. I'm sorry, we don't know. Here, take this drug. Just because that doctor doesn't know doesn't mean it's not knowable. So this statement here, it says, it's important to understand that an autoimmune disease is a state that your immune system is in. It is not a disease of an organ, even though it can manifest in a diseased organ. It is a state that your immune system is in. And even though it is given a multitude of names, depending on the tissue currently affected, it is a state of the immune system attacking that tissue that it was meant to protect. So we're going to get into this detail really deep through this course. So hang on if you're a little confused. But there's 4 main questions, or I call them rules, that we have got to follow if we're going to get anybody better that has a chronic disorder. And they are listed in the book, so make sure you download that section of the book. But they are basically, this is the rules that we follow with every one of our patients. Number 1, is this an autoimmune disorder? Is it the immune system attacking self-tissue? Number 2, if that is correct, then what is the antigen? The antigen is a term that we give to that thing that the immune system turned on against. So if there's a pathogen that enters your body, let's say a cold virus, and your immune system fires against it and kills that cold virus is called an antigen. So an antigen is something, anything, that the immune system has decided to make an enemy. So that's the second thing. Number one, is this autoimmune? Number two, what is the antigen or antigens if it's a long-standing autoimmune chronic disorder? What is the antigen or antigens that the immune system originally turned on against? Well, we know it's destroying self-tissue now, but why did it start there? Your immune system didn't just decide one day, I think I'll destroy the thyroid. That sounds like a fun thing to do. We're kind of bored. Let's just go kill our nervous system, or let's go destroy our brain, or let's kill the myelin sheath, or let's destroy the joint capsules. No, it turned on against those tissue sites because there was something there or near there that stimulated an immune response. There was something there or near there that stimulated an immune response. That something is called an antigen. We have to find out what that is. We're never going to get the patient better if we don't know what that is. So number one, is it autoimmune? Number two, what is the antigen or antigens that this thing initially turned on against? And number three, is this a Th1 or a Th2 dominant disorder? Super, super important there. You don't know what that is yet? That's okay. We're going to explain that throughout this course. That's why we have 12 sections here, and that's why it's a book. So the Th1 and Th2 side are sides of an immune response that we'll get into, but it's absolutely crucial that you know that. I can't tell you how many patients that I speak with that are Th1 dominant don't know that. No one ever told them that. They've been treating with doctors for 15 years. No one's ever told them that. They didn't know to ask that question. And yet, they're stimulating the Th1 side. So if you take things, consume things, supplements, medications that stimulate a Th1 response, and you are Th1 dominant, you are aiding the destruction of your own body. You're killing yourself. It's suicide. You got to stop doing that. Well, how do I know to stop doing that? Well, you got to find out if you're Th1 or Th2 dominant. And rule number 4. So there's 4 rules. Am I autoimmune? What are the antigen or antigens causing this? Am I Th1 or Th2 dominant? And number 4, what is the damage to the rest of the organs? What else do I need to support? Liver detox pathways, the gut, the blood-brain barrier, inflammation in the brain, anemia issues, glucose issues, lots and lots of other pieces that we need to put together in this puzzle. It's all fixable. You are fixable. Okay, there is hope. In our clinic, most of this can be done at a distance. You don't even need to come to Minnesota. Okay, I said it. We live in Minnesota. Yes. Most of our autoimmune patients we never see, except their beautiful picture on Skype. Because this can be done at a distance. Call our office if you have any other questions. Go to our website. Our website mainly consists of cancer and Lyme because that's what I specialize in. My partner specializes in the autoimmune issues. But we're here to take care of you. Call us if you have any questions. And we'll see you at the next presentation.